Hello friends, let us now learn some important points about diethyl carbamazine citrate. So the mechanism of action is this diethyl carbamazine citrate alters the microfilaриal membrane and it causes phagocytosis by tissue fixed monocytes. It causes phagocytosis by tissue fixed monocytes. This diethyl carbamazine citrate has piperazine moiety and thus it causes hyperpolarization. Because of this hyperpolarization, it causes flaccid paralysis leading to the expulsion of the worm. Because of this flaccid paralysis, the worm cannot move, so it is excreted in the feces. Then this diethyl carbamazepine will kill the microfilaria of Wuchereria bronchi and Brugia melai, which are present in peripheral blood. This will kill the microfilaria of peripheral blood only, not the microfilaria which are present in nodules or transsudates. So it will also kill the microfilaria of loa and also onchocerca. It will also kill the adult worm of loa. Pharmacokinetics are, it is an oral drug. This diethyl carbamazepine is an oral drug and excreted faster in acidic urine. Side effects are, it causes nausea, loss of appetite, and it also causes headache. Then this also causes febrile reaction with rash. It causes pruritus and enlargement of lymph nodes. It also decreases blood pressure. So if you see the uses of this diethyl carbamazepine, it is used in filariasis and topical eosinophilia. Then the next important drug is Ivermectin. This Ivermectin is a drug which will activate the glutamate gated chloride channels. When this activates the glutamate gated chloride channels which are found in invertebrate. So these glutamate gated chloride channels are not involved in motor control of flukes and tapeworms. It is not involved in motor control of flukes and tapeworms. So as a result, when you activate these chloride channels, this will cause tonic paralysis. It results in tonic paralysis, and in mammals this tonic paralysis is not seen because this ivermectin has low affinity for mammalian GABA receptors. They have very low affinity for mammalian GABA and glutamate receptors. So it does not have any effect on mammals. And this drug is also excluded or removed from the brain by P-glycoprotein mediated efflux. It is removed from the brain by P-glycoprotein mediated efflux. So this drug is safe in humans. It is used as a second line drug after diethylstilbestrol. So diethyl carbamazepine for microfilaria. Now pharmacokinetics are, it causes oral absorption, it has longer half-life, and it does not cause any CNS entry. It does not enter the CNS, and it is metabolized by CYP enzymes. Then because this ivermectin is not involved in the motor control of flukes and tapeworms, we will not use this ivermectin in the flukes and tapeworms. We cannot use them in flukes and tapeworms. You should remember that. Then if you see the side effects of ivermectin, this causes mainly GI side effects. It causes pruritus, giddiness. This GI side effects can be constipation, nausea. It also causes lethargy. It causes transient ECG changes also. This drug has no safety margin in pregnant women and in young children. It has no safety margin in pregnant women and young children. So if you see the uses of ivermectin are The main use is it is used in microfilaria, in treatment of microfilaria, strongyloids stercoralis, onchocerciasis, and treatment of scabies. So this is about the diethyl carbamazepine and ivermectin. Thank you for watching.